could not do it in all the patients. So as far as rheumatoid factor is concerned, rituximab, patients with RA or seropositive have definitely a better response to rituximab, and all our patients except one was seropositive. And in the seronegative also, when we had exhausted all options of treatment, we did give that patient rituximab. So 20 patients were, we had one patient who was RA factor negative, but rest all of them were rheumatoid factor positive.
Thank you so much. I'm sorry.
Just
the last question, Dr. Nikhil.
Let it be the last one. Thanks so much for those lovely lectures and nice research work. I just want to comment on, it's really nice to know that you, since I've been a teacher, that we have been teaching these criteria for diagnosing rheumatoid arthritis, those criteria, and then we choose 4 out of this. Now, as things are changing, I'm so happy that you have changed also the criteria, but I hope it starts coming in the books also, because looking at the 6 weeks criteria of having body pain, of pains in the muscles or joints, and then coming to a diagnosis, I think it's already too late. 6 weeks, you are losing 6 weeks already. And then you make a diagnosis, because by the time people come to the doctor, they have lost some time at their homes, and then they come to you. I hope now this 6 weeks criteria by the rheumatologist is put into the basket, and they say, all right, let's start coming up with anti-CCP antibodies instead of doing all those things of 7 and all these things, because anti-CCP is, I think, quite specific. So if you want to be specific now, why don't you go for a specific thing and diagnose it? And my other question is, would it be positive in the relatives also, because then we can keep an eye on them and start looking at those relatives too? This is a question from the rheumatologist. Okay. And before I give the mic, because you won't allow me to say, take the mic again, this is a request to my guest of honor of today, Professor Zafrullah Saab, that rheumatology is a very important field. And because I smelled that when you were giving a lecture that you want that after 2 years they can switch on to rheumatology. And I was requesting Professor Mir that please don't do it, because you have to know basic medicine before they go to rheumatology. And I hope you stick on to this, that after 4 years you go on to rheumatology. Thank you. Thank you for those claps. Because they are all with me, Professor. And number 2, another